Hello and welcome to the Zero to Finals podcast. My name is Tom, and in this episode, I'm going to be talking to you about liver transplants. And you can find written notes on this topic at zerotofinals.com/liver-transplant or in the general surgery section of the Zero to Finals surgery book. So let's get straight into it. The most obvious source for a liver is from a healthy person that has just died. When an entire liver is transplanted from a deceased donor to a recipient, it's known as an orthotropic transplant. Ortho means straight, and tropic means in place. The liver has the potential to regenerate as an organ. Therefore, it's possible to take a portion of the liver from a living donor, transplant it into a patient, and have both regenerate to become two fully functioning organs. This is known as a living donor transplant. It's also possible to split the organ of a deceased person into two and transplant it into two different patients and have them regenerate to their normal size in each recipient. This is known as a split donation. Let's talk about the indications for a liver transplant. Indications for liver transplant can be split into two categories: acute liver failure or chronic liver failure. They may also be used in specific cases of hepatocellular carcinoma. Acute liver failure usually requires an immediate liver transplant, and these patients are placed at the top of the transplant list. The most common causes are acute viral hepatitis and paracetamol overdose. Chronic liver failure patients can wait longer for their liver transplant, and they're put on a standard transplant list. It's normal for it to take around 5 months for a liver to become available. Let's talk about the factors that would suggest unsuitability for a liver transplant. Any of these factors would make a patient unsuitable for a liver transplant. Significant comorbidities, for example, severe kidney or heart disease, excessive weight loss and malnutrition, active hepatitis B, hepatitis C or other infection, end-stage HIV, and active alcohol use. Generally, 6 months of abstinence is required. Let's talk a bit about the surgery. The liver transplant surgery is carried out in a specialist transplant center. It involves a rooftop or a Mercedes-Benz incision along the lower costal margin for open surgery. The liver is mobilized away from the other tissues and then excised, so it's basically cut away from where it is. The new liver, biliary system, and blood supply is then implanted and connected up. Finally, let's talk about post-transplantation care. Patients will require lifelong immunosuppression, for example with steroids, azathioprine, and tacrolimus. And they also require careful monitoring of these drugs. They're required to follow lifestyle advice and also have careful monitoring and treatment of complications. This involves avoiding alcohol and smoking, treating opportunistic infections that may occur due to immunosuppression, monitoring for disease recurrence, for example recurrence of hepatitis or primary biliary cirrhosis, and monitoring for cancer as there's a significantly higher risk of cancer in immunosuppressed patients. They also need monitoring for evidence of transplant rejection, and things that might suggest transplant rejection are abnormal liver function tests, excessive fatigue, fever, and jaundice. So thanks for listening to this episode on liver transplant. As always, a big thank you to Harry Watchman for perfectly editing the podcast, and I hope you subscribe to the podcast so you join us for the next episode where we'll move on to urology and start by talking about obstructive uropathy.